With your eye on health, we're going to be talking about sleep. There are several types of sleep apnea, and one of the most common types is obstructive sleep apnea, which causes you to stop breathing in your sleep, which can obviously be scary. Today, Dr. Veronica Sesi is here with us in studio to explain the causes of this disorder and also how to treat it. Thank you for joining us.
Thank you for having me. My pleasure.
So how do you know if this is something that you're dealing with?
So basically you want to look at symptoms that you may have. What apnea is, it's cessation of airflow, and that's caused by basically structures within the throat relaxing and the tongue falling back. And so you can either have partial or full closure of the airway, and what happens is that dip in oxygen creates like a fight or flight response in your body. So we wake up periodically throughout the night. So about 6% of the population is affected by this, anywhere from 18 to 30 million people, it's estimated. And to know if you have it, it's really based on symptoms, so it's, and clinical evaluation and testing, of course. So it can be as obvious as snoring at night, actually noticing restriction in the breathing, stopping breathing, nudging from a bed partner can be an indicator too, of course. But a lot of people just have unrestorative sleep, wake up tired or tired throughout the day. And then in addition to that, you may have more restless sleep, sweating and sleep, headaches when you wake up, dry mouth. There's a lot of clinical conditions that can be an indicator that you may have this as well. But to know, really be evaluated and then sleep testing.
Can you wake up feeling almost like you're choking? Because I'd imagine that could be dangerous.
Yes, a lot of people do feel that way, and it can be dangerous because what's happening again, it's our body needs a steady flow of oxygen throughout the night, and when you're suddenly having this restriction in how much you're getting, you're expecting all your organs to function with lack of oxygen. So your blood pressure goes up as a result, and how the heart pumps and functions is affected. So we can see a lot of rhythm issues, we can see elevation of your blood sugars, and again, people can periodically wake up. Your brain does, but you may physically wake up and then it disrupts your quality of sleep. So there's a lot of danger associated with this in terms of health issues.
Yeah, I would imagine. Is there something that could make you more susceptible to this, or is it just kind of at random?
Well, several things. So high risk factors include age, so mid 50 and up really is where we're at the highest risk, and that's because of changes in muscle tone and increased tissue within the airway. Obesity is a risk factor, so again, increased structures within the airway, fat within the airway, and in addition to that, male gender. Hormone changes, so women are at lower risk, but when women go through menopause, risk is increased and it's equal to that of men. So have to keep in mind our pregnant patients are higher susceptibility of having this as well. We can see it in pediatric patients. We can see it in patients, it's not exclusive to obesity. You can just have a narrowed airway and it can cause this. There is a genetic influence too, so we may see family members may carry this, and that's also associated with features of the face and the skull and the airway as well. Different conditions like neuromuscular disease, patients who have had strokes are at higher risk, patients with cardiac disease, and patients on pain medications. So, it's very common for that to impact how we breathe as well.
Okay, so we've talked about some of the factors and who needs to be on the lookout. Let's talk now about treatment. You've brought some examples with you.
Yeah, so basically, again, it's that lack of airflow that's the issue. So this is a CPAP machine, and CPAP is the gold standard of treatment. Basically, it's pressurized air that the machine will generate, and what that does, it kind of works like a splint. It's keeping your airway open so that we can resolve those episodes. And again, it's gold standard because it's the most effective. It's really contingent in terms of like severity of apnea and weight for other treatment modalities in terms of how effective they are, but CPAP can work regardless of those things. So these are a few different options in terms of masks. Again, it's pressurized air that's delivered through a mask and it's worn while you sleep. Other options we have for people who can't tolerate a CPAP, something like a dental device. So basically there's several different models that there are, but this is custom fitted to your upper and lower jaw, and then it's basically moving your jaw forward to clear that tissue to open up the airway for you. And so effectiveness varies depending on severity of apnea, and weight's a factor as well. Hypoglossal nerve stimulation is another option, so that's a newer option, and basically what that is, it's a surgical procedure where a device is implanted, and it basically it triggers when the breath is reduced, and it basically forces the tongue to thrust forward while you sleep to kind of clear that airway and eliminate these respiratory episodes. And that's also, again, contingent on ability and inability to use CPAP, as well as severity, type of apnea, and weight. So Not everybody's a candidate for the different alternatives. You really need to be screened and evaluated and kind of see what works best for you and what you can tolerate. You know, so our patients who cannot tolerate CPAP, it's great. We have options for them. First and foremost, if the weight was a factor contributing, then we look at weight reduction.
Right.
So about 10% of reduction can help with severity of apnea.
So lots of options to look at. Thank you so much for bringing this with us.
Yes.
Hopefully you can find what you need and don't have to suffer in silence. Again, thank you for coming.
Thank you. Yeah, thank you for having me.